for more on this new advisory board, let's bring in Dr. Omer Awan, a physician and senior public health contributor for Forbes. Dr. Awan, thank you for being here. This advisory committee, in the past, it was selected because they don't work for the government and they don't work for the vaccine manufacturers. Does this new group, from what you know, fit that same mold?
I don't believe it does, Andrew, and I think there are definite conflicts of interest here. Some of these people on the panel are known vaccine skeptics, just like Senator Kennedy. Some of them have outright talked against the mRNA technology for vaccines that the COVID-19 vaccine states. Some of them have been outspoken against COVID mask mandates. So this means that there is going to be a lot of anti-vaccine rhetoric in this new group. And what that also means is that vaccines will be harder to get for people, and particularly those that can't afford a vaccine or vulnerable populations that don't have access to it. It will be very hard for them to actually get a life-saving vaccine. And when that happens, that translates to more people having illnesses, more outbreaks, more ER visits, strained hospital systems, and overall more preventable deaths, as we've already seen in certain outbreaks like the measles outbreak in Texas.
And you brought up the measles in Texas. Are there any specific vaccines that you think could particularly be in jeopardy in terms of their availability to the wider population based on what we've seen out of this new committee?
Well, I think all vaccines could be in jeopardy. Certainly the COVID vaccine will be in jeopardy because of what some of the new restrictions are, particularly for pregnant females, but also childhood vaccines, right? So the ACIP sets the schedule for childhood vaccinations, and that includes everything from, diphtheria, pertussis, measles, as we were just stating. So it's unclear whether they're going to approve these vaccines, if they're going to change it, if they change the doses, the timing. All of these things could be changed. And quite frankly, it's uncertain what the future of these vaccination schedules are going to look like. And if that's the case, and if they do change these vaccines, then I'm afraid that we're going to continue to have much more vaccine hesitancy and much more childhood diseases that are entirely preventable. And that's the important thing to understand. Entirely preventable diseases that then we'll start to see a resurgence here in America.
And we do know that most Americans do want FDA-approved vaccines that are available for them, their family, their children. Is there anything that policymakers can do, or maybe the doctors themselves, in order to ensure that their patients are healthy and getting the vaccines that they need?
They have to be advocates. Physicians have to be advocates for their patients and let them know that vaccines, for the most part, are safe and effective. They're life-saving. I mean, we're talking about the COVID vaccine also has saved millions of lives. I mean, research has shown that it saved more than 14 million lives during the pandemic, and that's likely a modest number. The childhood vaccinations have saved hundreds of millions of lives globally. These are communications and things that I hope doctors communicate very well and effectively to their patients. We need to have much more transparency with respect to what vaccines are, why they're important, their safety profiles with patients, so that they really understand what's at stake here.
And broader look at overall public health, especially here in the United States. What do you worry this could mean for the potential or the efforts to prevent infectious disease spreading and outbreaks here in the U.S.?
Well, I fear that they're going to start to soar again. I mean, if you take a look, whooping cough is already on the rise, and that's entirely preventable with vaccines. Measles is already on the rise. We have well over 1,000 cases of measles already in America, and this is largely a preventable disease. I mean, if, getting 2 shots of the measles vaccine is 97% effective at getting the infection. So when people aren't getting vaccinated, when vaccines are harder to get, we're going to start to see a resurgence of many of these diseases that we really shouldn't see. We should not be seeing a rise in whooping cough. We should not be seeing a rise in measles if people adhered to the vaccination schedule. So I'm very fearful that we're going to start to see many more outbreaks and many more infectious diseases that are really preventable.
All right, Dr. Omer Awan, thank you so much for your perspective and your time.
My pleasure.